Hi, my name is Dr. Greg Olsen. Welcome today. Today I'm going to be talking to you about discs in your spine, bulging discs, herniated discs, degenerated discs. Now, I've been in practice for 17 years, and in 17 years I've seen thousands of patients and hundreds of them with disc bulging problems, herniated discs, bulging discs, degenerated discs. Very common problem, something that dealt very well with the program that we do. So one of the first questions you may have is do I have a bulging disc? Do I have a herniated disc? Because I assume today that you're watching this because you have a concern. You have some pain in your spine, or you may have pain out in your hands or legs that you may be concerned is coming from your spine. So the spine has a set of nerve roots that come out from it. These nerves, right through here, each go out to a specific area. And the most common areas to get these bulges out where you're going to feel it would be the neck area and the low back area. And these areas that'll tend to go out to the arms and out to the legs. Now, when this happens, usually when a nerve root is involved, especially if it's just one that's going on, it'll have a very specific pattern. And that pattern, it can create pain or a weakness with you or a numbness. That goes distinctly in one area out the arm, one area down the leg to a certain path. That's part of the questions that we ask when you come in, if you're having these areas, is where is it bothering you, what's specifically pointing out to it. That tells me clinically what nerve root may be involved with you. Okay? Now the nerves in the spine, they can provide sensory supply, which means feeling in the skin. They can also provide the muscular supply, meaning the muscles that make your body work. Okay? So that's also part of identifying what is happening with these. Now let's say we do find that you have a herniated disc, a bulging disc, or a degenerated disc. What do we do? Okay? I'm going to show you a little visual first. Pardon me as I reach for the model here. Now a little lesson in how the spine works. We all start off with the normal spine. Normal spine gets injured or damaged through either posture, an accident, falls, bike riding, skiing, whatever it could be. Starts a process of degeneration, and basically the spine stops moving like it normally should. Now the disc in the spine requires movement. It requires normal movement in order to be able to feed the nutrients to that disc and keep it soft and spongy enough to where it's going to be a shock absorber for you. Now once that movement gets damaged, again from either a muscular pattern, a fall, or a trauma, that process of degeneration begins to take place. Now as it does, that disc begins to change. As that disc changes, it loses some of its height, it loses some of its elasticity, and then eventually in the next stage becomes in a worse state and becomes vulnerable to cracks and tears in it, where that center area of the disc, called the nucleus pulposus, can actually start pushing out. Once it pushes out from the middle far enough, it can start causing that bulge. That bulge can then push out either into the middle, which may press onto the spinal cord, or more commonly out to the sides where it affects the nerve roots that we talked about earlier that go out to the different extremities or arms and legs in the body. So that's a little bit about how that process occurs. Now what do we do for it that's unique? Obviously if there's a problem with a disc bulge or herniation or degeneration, it requires different types of work. One of the most common things clinically is to just take an area and focus on that one area. Say you've got a disc bulge in the neck. Okay, so let's get that area moving, and maybe let's do some decompression. Okay, now those are all have the potential to be effective, but there's a couple of things that in my protocol found to basically improve that process. Number one is looking a higher place. That higher place is looking up in the cerebellum. I'm going to look over here for a moment. So all of these messages from the spine pass up here and go through the cerebellum. Cerebellum has a feedback loop that controls, for us, what's called balance and coordination, and also then controls these intrinsic or internal muscles in the spine. So if this is getting an abnormal message, it affects the spine. When the spine gets clamped down on, it begins that process of degeneration. It cannot move. That can irritate the facet joints that can get jammed together. It can affect that disc. No longer can it move properly, so it begins to get irritated and inflamed. And then that facilitates degeneration. That degeneration then facilitates that disc bulging. And unless you've done something like fallen out of a tree where you've had a serious compact or impact in that area. So one area, again, looking above, whether that disc problem is in the middle of the neck or in the low back area, is first area we look at is the cerebellum. and proper treatment towards addressing that and getting that working properly so the spine will move. So if we do address it in the local area, it will respond much, much better. The second area is I'm going to refer over here. There are times when we see that the muscles that are involved with this can be affecting it. From the one standpoint, those muscles may be tighten and spasm, limiting how the spine's moving. Part of that can be from the cerebellum. Part of that could be from postural patterns or old injuries that you've established. Okay, so that's a really key additional component. Being able to assess and address those deep intrinsic muscles within the spine, as well as the larger groups that move out from there. And then additionally, identifying what we call myofascial pain and dysfunction or trigger points. Many people, for example, will present with arm pain that seems like a disc problem, but it may be that nerve root being irritated from a scalene muscle or another area of entrapment out in these areas. That's part of the importance of differentiating what's happening with you rather than just going in and jumping in to treat one area. Doing a good exam, finding out what area is involved so we can properly treat you both on a local basis, neurological basis, and even a myofascial basis. So hopefully this has been helpful to you. We do get great results with people with disc problems, whether it be, again, with regard to the neck or the low back. So if you're watching this today for yourself, or if you're watching it for somebody else to get them help, that is our purpose. My purpose in practice is to help as many people as possible. So I'd be excited to help you or the person that you're watching this for. So please give us a call. My office number is 949-859-5192. And the website is askdrolsen.com. Thank you for visiting today. Hope I've provided some valuable information for you. And I look forward to seeing you or meeting you. Take care. Bye-bye.